Hi everyone, my name is Zaylee, and today I'm going to be reviewing my doctoral capstone experience, also known as a DCE. Some background and information about my site. I completed my capstone at the KU ALS clinic. The KU ALS clinic is an interprofessional clinic located inside the Landon Center on Aging, right here near campus. And given the progression of ALS, individuals living with this disease will eventually need to possess a power wheelchair. Although a power wheelchair can lead to increased independence, there are still barriers that patients face after receiving their power wheelchairs. So, my rationale for my project was that streamlining the initial power wheelchair evaluation will better address the complex needs of the clients. For my role and purpose, I was to identify and reduce occupational performance barriers, and I was going to do this by implementing client-centered questions to the power wheelchair eval process, produce materials addressing common environmental barriers, and increase occupational performance for ALS power wheelchair users would be more so of the purpose of my DCE. Learning objectives were to acquire knowledge about the power wheelchair eval process, demonstrate occupational therapy's value in providing client-centered care, and identify common occupational performance barriers experienced by ALS power wheelchair users. For program description, I sort of just included what programming entailed, so additional questions guided by the Ecology of Human Performance, or EHP. My question was, is the revised wheelchair eval client-centered? So for my criteria, I sort of referred to the question. So I considered the eval client-centered if it included both of these things. So 90% of clients receiving their initial wheelchair eval are asked at least 3 questions related to context, and then 90% of clients receiving their initial power wheelchair eval are asked at least 2 questions related to the person. For both of those, I gave examples in parentheses, and then as you can see to the right, on the right side of that chart, both of those were met after programming. I did this by collecting data on initial power wheelchair evals. I used that to determine questions to add to the power wheelchair eval. And then I also provided a Likert scale pictured below to the therapy team or the 2 main clinicians performing initial wheelchair evals, just to address sustainability and use. That statement for the Likert scale was the additional questions implemented by the student were beneficial and will be included during future power wheelchair evals. As far as results and conclusions, questions regarding social support, home environment, and assistance for tasks were being asked. So I decided to focus on questions about expectations, hobbies, and leisure for the power wheelchair specifically. However, after programming, there does continue to be room for growth to promote client-patient collaboration. Another part of my project was that I created a pretty hefty resource for home accessibility, medical equipment, and transportation, as those were all common barriers and topics of stress. And then below that, you can see a bar graph that sort of depicts the amount of questions asked before programming and then after. And I broke those down. Each section is a domain of EHP, so person, context, task, and performance. And then below that is the Likert scale and scoring responses from the clinicians. One of them rated it 3, neutral, and the other 4, agree, for question sustainability and use. As far as future directions, students may consider addressing individuals who are thinking about getting a power wheelchair, so showcasing independence and how a mobility device can help, as well as a quick reference guide for power wheelchair users, so frequently asked questions for features and use. And then below are my references and deliverables, so feel free to scan those QR codes, especially the second one to access my resource. But if you do have any questions, please feel free to reach out. Thanks.